This is the interesting case in which she presented with a posterior glide fixation of the left pubic bone. She also had a very tight left sacrotuberous ligament and what looked like a left sacral rotation about a vertical axis, and a left posterior ilium. Her compensatory pattern was up at T3 and T4. The treatment that I did for her was I spent 300,000 milliseconds, aka 5 minutes of force on the pube and ischium interface to restore anterior glide on the on the left. So it worked. These are now symmetrical, and I don't like that word symmetry. I don't like alignment either, but you'll notice the function is improved because now I can readily take up slack on the right side, and when I spring, the force goes into her body through that structure. Let's have you lie on your stomach, please. This is the PSIS here, so if I slide onto the sacrum, there's no longer a mobility restriction on the sacrum. There's no longer a mobility restriction on the ischium on the left. And same for left ilium. I'm probably blocking the camera, but this ilium rotates forward. Get out of the way. So there's taking up the slack, and there's a spring. When I let go, there's a final spring. The compensatory pattern in the rib cage melted as well. So initially, we gave it several names, but we only had to treat one component. And this correlates with what we see on her x-ray, which is that the pubic joint is more wide than is normative, and it has more potential for mobility. And of course, if the pube has such, then so does the SIJ. And I think that this is a case of a bona fide SIJD/pubic joint dysfunction. And I will stop filming here and accept. Would you go ahead and spontaneously just tell us what you said spontaneously when I asked you to walk and asked how did that feel? What was your response?
Well, it felt stable and level.
Stable and level.
Mm-hmm.
Anything else?
Not that I can think of.
Very good. I'm done filming. Thank you for letting us film this. I really appreciate that.